Well, welcome back to OpenLine, talking about expanding Medicaid in Tennessee, talking about the plan that would do that, Insure Tennessee. It has failed recently. Can it pass? Will it come back up? There is a strategy to do that, and we're talking with three people here who know all about that. Now, a moment ago we were showing a map. The map shows the states that have expanded Medicaid, and you notice Kentucky, and Bruce Parks has come all the way over here from Clarefield and Campbell County. How close do you live to Kentucky, Bruce?
About driving, about a 10-minute drive.
So if you were a few miles away, you would be covered. You would have insurance.
Yes. I've had people to ask me, my family and friends, why don't you move to Kentucky? That way you can get the help you want. I don't want to live in Kentucky. I live in Tennessee, and that's where I want to be.
And do you know anyone who has moved?
A few people, yes. I've had a few friends that has moved. My brother moved because he couldn't get help. He moved to Kentucky, and now he's getting the help that he needs, him and his wife.
So how weird is that? And I guess anybody can answer that, but that's pretty. So you're now having to decide if you're going to live in Tennessee, and people are actually moving to another state.
Or I could go and lie and say I live in Kentucky and give a Kentucky address and get the insurance. And I don't want to do that. I was raised to be honest and fair. I'm not asking people for a handout. I'm just asking for what I think I deserve. I've worked, I've paid my taxes in. And now it seems like I've just been pushed to the corner. And I don't want to die. It's like I told my doctors, I got great doctors, I really do, but their hands are tied too. When you ain't got the insurance.
Right.
It's like with my blackout spells, they wanted to do the MRI and things, and I couldn't come up with the money because they wanted cash. I couldn't do it, so I didn't do with that.
So how unusual is that there's this hodgepodge of states out there, and two of our neighboring states have passed it and we haven't, and what do you think about that?
Well, one of the things I do too, I act as a certified application counselor, and I help with enrollment under the Affordable Care Act. So enrollment opened November 1, it ended just January 31. The Tennessee Healthcare Campaign, where I'm a volunteer, we operate an 844 number, statewide toll-free number. 20 volunteers answer those calls from 8 in the morning to 8 in the evening, basically connecting them to a navigator, connecting them to an agent broker, connecting them to a CAC. Probably about a fourth of those calls are people who fit in the gap, just like Bruce. In other words, they call, they hear they can get health insurance, they call. They're a little bit scared because they hear about this penalty, but if you're in the gap, you don't have to pay the penalty. So that's one of the things that we tell them. And then we refer them to a fairly qualified health center where they can get primary care, but they can't get the kind of care that Bruce needs.
Yes.
So we get those calls every day. About a fourth of those calls come from people who are in the coverage gap, and there's no program that Tennessee has that can help them.
Let's go to Rocky. Hello, Rocky. Rocky, are you there? Hello, Rocky. One more? Okay. Come back if you want. And I think it's interesting. What is the conservative argument for this? Because as we have established, this does get caught up in a larger national political debate. But in Tennessee, what is the conservative argument for doing this?
I think the conservative argument for doing this is, first of all, we're going to start to have our rural hospitals close. If the rural hospital close, then we're not going to be able to attract businesses, we're not going to be able to attract jobs. And remember, the hospital jobs are good jobs. This gives our high school students that live in these rural areas the incentive. They can go to a community college for 2 years and be a registered nurse. They can go and become a respiratory therapist. They can become a physical therapist. We may have some of the very ambitious ones that want to come back to their rural communities and be doctors. The second thing is, and we know that $1.3 billion will create early on, the first 2 years, 15,000 new jobs. That's significant. I think the conservative argument also is that it'll improve the health of our workforce. And because we are in a healthy state, I had a little button that I wore during last year's legislative session that had 45. That's our rank. We're the 45th poorest health state, and it had one of those little lines through it. We don't want to be that anymore. We need to be healthier. That's very important for business. And then we also, and we've talked about Bruce, these are good, hard-working Tennesseans. And also we have veterans that are good, hard-working veterans that have served their country. We don't have the draft anymore. We owe those people, those who have not served. Remember, only 1% of our population has served in this war on terror. And the other 99% owe those people something, and they still are working and have jobs, and these are the reasons, as a conservative, that we need to do it, and also we can afford it. We're not buying something we can't afford.
And so, Tony, it has failed. It failed recently. Where do you go now?
We've talked about the coverage gap. There's also a huge educational gap, where basically our legislators don't really understand. Having Senator Briggs here and being a champion of Insure Tennessee, I've had the opportunity to hear Senator Briggs several times. He is a very passionate and very knowledgeable speaker. I think we still have to educate not just our state legislators, because our state legislators, their constituents is telling them that they don't support it, but it's a loud minority. All the polls that have been taken by Vanderbilt or otherwise saying that the public supports this, but there is a loud minority that scares our state legislators. But I wish Dr. Briggs had the time to personally talk to every state legislator, because I know I can't persuade them, but Dr. Briggs, I'm not to put a lot of, but really, he's very persuasive and he understands the issue. Being a doctor, being a veteran, he has all the credentials that I don't have.
And well, let me go back to the phones. Jody, hello, Jody.
Yes.
Hi, go right ahead.
Hey, my question, what did these folks do prior to, how they end up with no insurance, I guess? Were they on some plan and then Obamacare passed? And then, I mean, what happened to their insurance? At some point they had insurance, I'm assuming.
Okay, what about that? And what's your situation?
The job, where all the jobs I worked, never supplied the insurance.
That's,
just plain, they never supplied it, and like I said, and I couldn't afford to get it.
And you worked again, where was it you were working?
I was working at the Sleep-In Suites in Middlesboro.
Right. You were
at the motel, I was a maintenance.
And many of these jobs, they do not supply insurance.
Yes, and the steakhouse I worked at when I had a massive heart attack, they didn't supply insurance for us.
And a lot of people had to be disenrolled from TennCare. How do you answer that question, Senator?
Well, the insurance, quite frankly, is, and I'm going to take a little bit of, I'm going to take up a little bit for our small businesses, because the insurance is very expensive. As a medical doctor, I'm a small businessman too, and I know at one point we had, I don't remember how many it was in the 40s employees of our company, and our premiums had gotten up to $1,200 per employee per month. And we also had a $500 deductible with that plan. At one point we covered everything for them, but it was just getting too expensive. So even if you tried to go out and buy private insurance and we were getting group discounts, it might have been $1,200 or $1,500 a month and increasing every year. And to be honest there,
we're going to have to take a break.
Okay.
Sorry.
Okay.
Very sorry.
Somebody's got to pay the bill.
Absolutely. Okay, we'll take a break. Be back. Wrap everything up right after this. Yeah.